duct, which is the main collecting or excretory duct of the pancreas, of the exocrine pancreas. This obstruction is associated with increased and result in obstruction. This will result in viscid or thick secretion. The pancreatic secretion or pancreatic duct will be filled with thick secretion, with fluid, without fluid content, and only thick secretion. This is the cut section. A cut section in pancreas showed you the foci of semi-high chalky spots of fat necrosis and the necrosis around the blood vessel. So it is called acute hemorrhagic pancreatitis. Proteases causing damage to the wall of the blood vessel, and lipases digest intraparenchymal and peripancreatic fat. The mechanism in which alcohol, so the main two causes, أهم two causes هي alcohol and common and the obstruction by gallstone or cholelithiasis, and alcohol are the direct alcohol and also direct acinar injury. So alcohol increase the pancreatic exocrine secretion. Alcohol consumption increases the pancreatic exocrine secretion with the decreased fluid content inside, and the pancreatic juice becomes very thick and viscous and called pancreatic plugs or stone-like. Pancreatic duct will be blocked. The main pancreatic duct will be blocked or will be obstructed by this thick secretion that are causing distension of the main pancreatic duct. This collected or stagnant secretions will stimulate the release of inflammatory response and inflammatory cytokines, and also the oxidative, and alcohol encourage the oxidative mechanism and generation of free radical reaction, and also direct toxic effect of alcohol on the acinar cells themselves. All these factors will form or result in a pancreatic acinar cell injury or acute pancreatitis, attack of acute pancreatitis. Gallstone is another cause of obstruction of the pancreatic duct, in which the impaction of the gallstone can be in the sphincter of OD or in the main pancreatic duct. The pancreatic duct will be blocked, and the pancreatic juice will so the both mechanism or the same for both risk factors or mechanism in alcohol and gallstone. The pancreatic duct or main pancreatic duct is obstructed by thick pancreatic juice, and when it is obstructed, the pancreatic secretion will be returned back to the pancreatic acini and small collecting or small ducts, interlobular and interlobar duct, into the parenchyma, result in, so the pressure is increased within these ducts, and zymogene granules that are containing digestive enzymes, zymogene granules within the cytoplasm of acinar cells will fuse with the lysosomes, and trypsinogen will be transformed into activated trypsin. So trypsin is very important to initiate, or activated trypsin is very important to initiate autodigestion of the pancreatic parenchyma by its own digestive enzymes. So activation of the trypsin or activated trypsin will digest the enzyme, result in digestive enzyme activation and autodigestion of the pancreas. The main mechanism is obstruction of the main pancreatic duct and return back of the secretion, and increase the pressure within these ducts and release and return to the zymogen granules will fuse to activate the trypsinogen into trypsin, which will start the process of pancreatic autodigestion. Again, cholelithiasis, impaction in the ampulla of Vater, obstruction with increased ductal pressure. The main pancreatic duct. Again, alcohol consumption will result in secretion of protein-rich pancreatic fluid, or نسميها protein plugs, calcified protein plugs within the pancreatic fluid, and direct acinar injury caused by alcohol or even by toxic metabolite of alcohol and generation of free radical reaction. Viruses can causing direct injury, and certain drugs, trauma, direct trauma and ischemia, all of these changes are causing this acinar cell injury. Again, the enzymes, proteolysis by the enzyme protease, lipolysis by lipase, and so the activation of trypsin will convert all the pro-enzymes into activated enzymes, precalcarine to calcarine, that is activate the kinase system and clotting system. When clotting system is activated, it is very dangerous, very severe, leading to local inflammation and thrombosis, and even systemic clotting disturbances, what we call it disseminated intravascular coagulopathy, DIC, disseminated intravascular coagulopathy. This is another picture showed you the acute hemorrhagic pancreatitis, digestion of the pancreatic parenchyma. The blood vessels are digested by protease, fatty tissue by lipase, and also direct acinar injury related to the cause itself. Morphology, microvascular leakage and edema, proteolysis, destruction of the parenchyma, and necrosis of the blood vessel caused by protease enzyme, and hemorrhagic necrosis, also fatty necrosis, and acute inflammatory response. Acute inflammatory response indicated by presence of neutrophils. The pictures for acute pancreatitis, you can here there is few remnant of pancreatic exocrine acinar cells. Here there is fat digestion and foamy histiocyte collecting lipid, foamy histiocyte, and it is a feature of fat necrosis, neutrophils infiltration, and this is a disrupted or necrotic wall of blood vessel due to digestion by proteases. The chronic pancreatitis. شباب, chronic pancreatitis, like acute or chronic gastritis, chronic cholecystitis. يعني what is the similarity? It is formed of repeated attacks or repeated bouts of acute pancreatitis. So the process of pancreatitis is persistent, long-standing. Again, chronic inflammation. Chronic inflammation. Can this chronic inflammation of the pancreatic parenchyma is it a risk factor for pancreatic cancer in the future؟ شو تتوقعون؟ Repeated bouts of inflammation of the pancreatic parenchyma, is it a risk factor in the future for pancreatic cancer or not? شباب. اوكي. persistent شباب شو ما حد يجاوب، اكو احد؟ ماكو احد، صوت مسموع؟ لا. كمل. persistent chronic inflammation. الحمد لله يجاوبوا انتم، شنو يعني؟ جاوبوا ابني. persistent infection persistent long-standing or attacks of chronic inflammation of the pancreas can result in autodigestion, and also in the future they are risk factor, or as I say, irreversible injury. It is an irreversible injury to the exocrine and endocrine pancreas with associated fibrosis, many-cell fibrosis. So the process is irreversible with associated calcification. In advanced stages, there is atrophy of the pancreatic parenchyma, and in later stages, in earlier stages, the islets of Langerhans are not affected, but in late advanced stages, there is fibrosis of islets of Langerhans, and even diabetes will be started. So there is process of chronic inflammation and autodigestion, which is irreversible. هذه الصورة بمحلها. The most characteristic microscopic feature in chronic cholecystitis is fat. Chronic pancreatitis is fat necrosis, which is spread throughout the abdominal cavity, deposited in the X-ray. On abdominal X-ray. هذه سوري، هذا السلايد مال acute شرحناه بس ما شفناه حقيقة. This is for acute. The most characteristic microscopic feature for acute cholecystitis is fat necrosis, and chronic pancreatitis is the characteristic feature is fibrosis and calcification due to autodigestion and irreversible damage. هسه أحولها إن شاء الله. Pancreatic pseudocyst. This is a term, pancreatic pseudocyst. What is pseudocyst شباب in general؟ شنو يعني pseudocyst؟ pseudo. why pseudocyst؟ why pseudo؟ ليش مو cyst؟ ليش مو pancreatic cyst؟ وحقيقة أكو عندنا pancreatic cyst, but this is the pseudocyst special entity in pancreatic diseases. It can be a complication for both acute pancreatitis and chronic pancreatitis. Pseudocyst means there is cystic formation without lining epithelial formation. There is localized collection, fluid collection of pancreatic enzyme, necrotic debris, and blood surrounded by non-epithelialized wall. No epithelial lining of this pseudocyst. Only there is collection of fluid, necrotic debris, enzymes, and blood with surrounding fibrous tissue and granulation tissue formation. It is arising from repeated bouts of acute and chronic pancreatitis and occurs due to disruption of the pancreatic duct and accumulation of pancreatic fluid. It is a result from disruption of the pancreatic duct after bouts of acute and chronic pancreatitis with accumulation of the fluid inside. This is the pseudocyst. You can identify here the atrophy in the wall of or atrophy in the pancreatic parenchyma and formation of this cystic-like structure containing, it is opened already, and it is contain fluid which is composed of cellular debris and necrotic material, blood, and pancreatic enzyme. And so it is one of the complication of acute and chronic cholecystitis, pancreatitis. Acute pancreatitis and chronic pancreatitis complications. You can تقدروا هاي تشوفوها this table and or this diagram to show the multiple complications or sequelae of acute and chronic pancreatitis. Pancreatic cancer or pancreatic adenocarcinoma. Pancreatic adenocarcinoma is highly malignant, highly lethal malignancy of usually unresectable at presentation with ominous and severe and very bad prognosis and high mortality rate. The risk factors including chronic pancreatitis or repeated attacks of pancreatitis, genetic mutations, especially BRCA1 and BRCA2, and the other associated risk factors for other malignancies like colorectal malignancy and gallbladder malignancy, smoking, obesity, and sedentary lifestyle. sedentary يعني عكس الاكسرسايز يعني حياة الرفاهية, sedentary lifestyle. And the pancreatic cancer is a form of pancreatic adenocarcinoma. You can see the tumor is made up of small ducts or small cyst or cystic ducts and or acini. And this is another picture. Most of the tumors are presented in the moderately differentiated and even poorly differentiated pattern. Malignant glands are surrounded by fibrosis, extensive fibrosis called desmoplastic reaction penetrating the pancreatic parenchyma, and they are cuboidal. تشبه cholangiocarcinoma or gallbladder cancer. Still, they are low cuboidal or low cuboidal to low columnar. This is a gross specimen. Showed you the well-defined solid tan colored mass of pancreatic cancer here. It can be arises a background of chronic pancreatitis or with genetic predisposition and another risk factors. The spread can be present, one of the presentation or one of the late presentation. شباب pancreatic adenocarcinoma, about 60% of pancreatic or about 50%, 50 to 60% of pancreatic cancer are presented or are arises in the pancreatic head. So it is presented with obstructive jaundice, whereas the adenocarcinoma arises in the body or tail of the pancreas. They are silent and not presented with obstructive jaundice because they are not obstruct the bile flow. Also, it can be spread through lymphatic to adjacent or regional lymph node and to the liver through portal circulation, to the lung and to the bone. And prognosis is very bad, extremely poor. Only 10% of patients survive the first year after diagnosis. Sorry. اتفضلوا إذا عندكم سؤال شباب. أكو أي سؤال، أي استفسار، أي question regarding the pathology of the pancreas, acute pancreatitis, chronic pancreatitis, pancreatic pseudocyst, and pancreatic cancer. ماكو سؤال؟ اوكي.